So just a few basic slides, but I just wanted to talk to you about how we've managed to integrate Medicines Complete into the MPharm program at Aston University. So I'm currently a senior lecturer on staff at the university, but before joining full-time, I was a senior clinical pharmacist at a local hospital, and I specialised in cardiovascular care and also cardiovascular surgery cases, including Gooch as well. So some really specialist work that I was doing alongside general cases. Now, Medicines Complete helped me throughout my career with the general work and the really specialised cases. And it was really key to my day-to-day practice. So when I'm at the university, it was really key for me to really make sure that my students also knew how to use Medicines Complete for their future practice. And I think it's the way that pharmacy education is going now, that with information expanding to such a degree, it's not going to be possible to know everything. But as long as you know where to look for information and how to interpret that for your patient, you're always going to produce a safe outcome. So we embedded Medicines Complete by providing students with an introduction and also then some time for orientation and practice with the resource before using it fully in timetabled teaching sessions. Now, with this, it's really important to make sure that everything is timely. If you have an introduction and orientation that's too far away from your in-session use, students obviously can forget what they've actually done in terms of that orientation time. So scheduling can be key to making sure that this is a successful process. So in terms for us at Aston, we have resource lectures and we have great support from our library information specialists. And they give walkthroughs of usage, a bit like John has done today, with some specific examples. That allows students to work through it live with us, with examples, so they can start to feel comfortable. We recognise that students will learn in a variety of ways and also provide written guides with worked examples for students to go back to and learn in their own time. We recognise that for some students, navigating through things for the first time might take them a bit longer than others. Not everyone is always as IT savvy. That also then acts as a really good point for our students to go back to. So say over the summer period where they've been having a great time on placement and doing other activities, when they come back the next term, they can then re-access those guides as a refresher. We also make sure that Medicines Complete has really easy access for all of our students. So we provide direct course links on our modules of study. We have direct course links on our library lib page, which is a specialist page for pharmacy students to go to for all of their resources. And it's really well signposted when they try to do any evidence searches within the library. So say if they were looking for one of the resources that's housed on Medicines Complete, it would flag up that they should be accessing that through Medicines Complete and give them a direct link. So our library information specialists have done some really great work to help us with that. So once we've obviously given some time and some materials for students to be introduced to the platform, we do provide them with quizzes to orientate them towards specific resources. And a good example of this is using a quiz base for the use of Stockley's on drug interactions. We try to relate the quiz questions to issues or tasks that will be expected of a pharmacist in practice. And we ensure that the quiz is timed and promoted for use before their taught sessions and workshops, where they're then going to be expected to refer back to Stockley's and use it for problem-based learning in patient cases. So we have a variety of different ways in which we use it in our teaching. So workshops are one. We also have a series of decision-making lectures where we use voting technology. In those lecture series, we encourage students to use the evidence base. And for that, we really do push them heavily towards the resources on Medicines Complete because it's so comprehensive. We ask them to think about what they're looking at and make patient decisions based on that information that's going to lead to the best outcome for the patient. And we're able to increase both our decision-making lecture series and our workshops involving clinical cases. We increase them in complexity, both through each academic year and from year to year in a spiral curriculum. In our final year, we also involve the use within our assessment. So in our final year, we have a case-based assessment that is completely open book, and students can use any internet source they wish. But throughout their training, we've been promoting them to use Medicines Complete. So the thing that they're most likely to use in that case-based assessment are the tools and the resources on MedicinesComplete for them to come up with treatment plans for given patients within that assessment. And that's been something that's been seen to be really realistic in terms of an assessment that's closely related to practice, and is allowing us to assess that student on that competency level of just about going out into the next stages of their training to be a pharmacist. Apart from the teaching side of the everyday MPharm, which is one of our largest courses in the School of Pharmacy, it also helps me in other ways as an academic. So it's obviously a great reference source. So for my own academic writing, for assisting my students who are doing projects with me in local hospitals and research. And it also allows me to assess student safety. So obviously it's important that we don't let students go out into their training who are unsafe to practice. If students are making unsafe decisions in case-based assessments or OSCEs, I can use the evidence base on MedicinesComplete to help make a judgment call on whether that student is actually safe to pass. The additional texts that are also available, because obviously you can pick and choose what you have access to, also allow me to tailor specific electives and bring them into the course as well. So just last year, we started an elective, so that's where our students have a choice of study on palliative care. And for that, I then bought the add-on of the palliative care formulary to our MedicinesComplete subscription. And that's been really key to students having a successful elective where they've got a specialist resource to support them with that specialist learning.